All right, perfect. We're going to get started. Good morning. Thanks for joining us today in this new larger room. I am Adria Berry, Executive Director of the OMMA and Chair of the Executive Advisory Council. And I call this meeting of the Executive Advisory Council to order at 9 a.m. I'll read just a few housekeeping reminders first, and then we'll get started on agenda items. As required by Oklahoma's Open Meeting Act, which is found in 25 OS Section 311, advance notice of this regular meeting was provided to the Secretary of State before December 15th of last year. The notice included the date, time, and location of this meeting, and then the meeting agenda was posted Wednesday, July 15th at 1 p.m. As a reminder, this meeting is being live streamed and recorded. For the audience online to hear, please make sure you turn on your microphone before you speak if you are giving a public comment or if you are a member of the council. Those who have signed up for public comment will be called by name as we move through the sign-in sheet, and we'll have 3 minutes to address the council, and Cassie will be keeping time. Cassie, please conduct a roll call so that we may establish whether a quorum is present.
Chair Berry.
Here.
David Gerken.
Here.
Sheriff McGuire.
Here.
Stephen Roper.
Here.
Taras Falinko. Sheriff Johnson.
Here.
We do have quorum.
Thank you. The quorum is present. I'd like to welcome our newest advisory council members. First, we have Sheriff Matthew McGuire, who is an appointee of Speaker of the House Kyle Hilbert, and holds the position set out in statute of a citizen from a county with a population under 25,000. Sheriff McGuire, welcome. And would you like to introduce yourself?
I appreciate it. Thank you. My name is Matt McGuire. That's kind of what I go by. I went around the room, was able to meet most of y'all, so I appreciate your time. I look forward to representing a smaller rural community. I also have an agricultural background as well as law enforcement, so I look forward to trying to be productive on this board. So thank you. I appreciate it.
Thank you. Our next newest member is Stephen Roper, who is also an appointee of Speaker Hilbert. Mr. Roper holds the position of a current medical marijuana business licensee. Welcome, Mr. Roper. Would you like to introduce yourself?
Yeah, thank you for the opportunity to be here. I represent this side of our licensees for dispensaries. I own multiple locations, and so hopefully I can assist the council in how these things at these meetings affect our businesses, right?
Thank you. Appreciate you both being here. We do have a quorum, so we will move on to voting to approve the meeting minutes that I believe Cassie sent you in your emails. Cassie, please call for and record the votes.
Chair Berry.
Aye.
David Gerken.
Aye.
Sheriff McGuire.
Aye.
Stephen Roper.
Aye.
Sheriff Johnson.
Aye.
The motion passes.
Okay, so the meeting minutes from the last meeting are approved. Okay, so we are going to first start with public comment, as we like to do. Comments are limited to 3 minutes per speaker, and a maximum of 10 commenters will be heard. It looks like we have 9 signed up. All right, these public comments are an opportunity for the council and the room to listen to what's being brought to us. When your name is called, please come forward. There's a seat right here reserved for you. You will push the button so that the red light shows, so that lets you know the microphone's on, and begin your remarks. Please remember to make sure the microphone's on so the people online can hear you, and we will move through this professionally and respectfully as expected. I'll now call speakers in the order they signed in, which we start with Jeffrey Havard, I believe I'm saying it right, from Havard Industries.
All right, so my name is Jeff Havard with Havard Industries Testing Lab. So to my knowledge, we're the only live streaming and transparent testing lab in the United States. So I wanted to bring up a few topics. I realize that we're going to be talking later on about the updates of the QA lab, but we have some additional things that we would like potentially addressed and answered during this period. One is that we would like to know the operational status of the QA lab. There are certain different parts of OAC 442 that have different laws that are enacted when the QA lab is considered operational, and we'd be very curious about that. Also, we did see that the lab has been accredited for both THC potency and also pesticides in flowers since October of last year, which has been 9 months ago. So we're just curious what has been done from that point in time. That actually brings me to my point number 2, is the status of the Secret Shopper program. What has been done? How many products have been checked? Where are the reports for the Secret Shopper program? Any results that are related to that at all? The last thing on that is we also want to address metric data again. There's been so much manipulated metric data that is available, and if that is being used in order to compare results against for off-the-shelf testing, then we just think that there's a lot of compromised data out there, and we still believe that having some level of transparency in metric data would be helpful. So not that we need personally identifiable information about like operators or products or other things, but being able to detect trends such as what pesticides are coming up, if there's problems, seasonal problems, and microbial failures and other things that are coming up, those aren't available for us to see and to be able to look out for and address these issues and problems as an industry without being able to see that type of data. So we respectfully request some responses and answers to these questions. Thank you.
All right, thank you for your comment. We are going to comment on a lot of these things, and we've been putting out information on our website about a lot of this. I believe I think I've made it, metric data is statutorily protected, so this would be a statutory change that needs to happen, and I will continue to say that to us and to legislators if that's something that needs to change. Next is Mo from Havard Industries.
Hello. My name is Mo. I'm with Havard Industries. I think it'd be cool if actually the public comment period would be actually at the end, so we can hear what you guys have to say. That way, some of the public comments may not be so redundant. So in that way, there's more fluidity. I think it'd be great if it was at the end, so we could hear what's being discussed. I know you guys again are in a tough situation where you're usually being demonized. I think it's obviously you filter out the people that are expecting perfection. That's just not really realistic. I think, though, progress along with accountability is pretty huge. But with the accountability, the big thing, I think, is who watches the watchers. So with you guys being in charge of audits, I know from like our experience with like what Jeff said, and I keep doing research, I don't see any other analytical labs in any industry being live streaming, showing their protocols, trying to build transparency. That's something that I would definitely encourage OMMA, whenever they do get their QA lab open, to also look into. If you want to have credibility and accountability, not just in Oklahoma, but I would say honestly in the whole nation, and leading transparency in science. That's why we try to lead by example, but that doesn't really, that isn't the most economically incentive in a free market or a pretend free market. I think with such a large budget, the 30+ million like a year, is it really being used efficiently? I think that would be definitely a big question. I get that it's hard with such a large agency to have all your checks and balances, but obviously with a large budget, that should be very easily attainable with having employees and other people that are willing to check those safeguards. And I think that with the non-transparency, I know you said earlier with metric, that being a legislative issue, other states have done it, and I think one of the rough parts is for owners and operators when they have to put out a sign on the front of their facility that says, "Here I am," in an economy that seems to be going down. I've heard of a lot of people being broken into, and they're like, well, what's even the point of reporting it, because nothing's going to change. We're just going to get hit again in a couple weeks. So instead they're having to hire their own security. So I think having, obviously you guys having the data of where places are located, but to really put it on public display and then talk about transparency and metric being a risk rather than having your signage out front to be like, please come get me, is kind of, I think it's a little ironic. I get that, again, nothing's perfect, but with also saying, I understand your perspective of whenever you said last time it would be great if manufacturers would stop putting out bad products. And I think that's why we're saying without transparent metric data, how can patients practice discernment?
That's time.
Okay, thank you. Have a good day.
Okay, thank you. Next, we have John Kumbas.
Am I on? My name's John Kumbas, owner-operator JKJ Processing. Congratulations to Mr. Roper for being picked to be on the board. I appreciate you. Just a few things, I wrote them down because I get all in my head when I'm up here. I would like to know, nothing against anybody else on the board, but I'd like to know, like, the two officers. I'd like to know what they're doing to help the businesses in Oklahoma, what they're doing to help the patients in Oklahoma, to the cattleman. I'd like to know what they're doing as well to help us. In regards to packaging, are we going to have a clear-cut directive on our packaging? Because up until this point, for the past 8 years, it's all been subjective. One inspector can say, oh, your packaging looks good. The other inspector can say, no, I don't think it looks good. And then we're subjective. We're riding a gray line as operators to make sure we're doing everything to the best of our ability to stay within the letter of the law. But it's all subjective because we don't know. There's nobody at OMMA, and nothing against OMMA, but there's not a group of people at OMMA that we can send our designs into, and you guys say, no, that's kid friendly, I'm going to need you to change this. I know that's a lot more work, but when we make these changes, the lawmakers make these changes, we're not ordering 500 bags at a time. We're ordering 50,000 bags at a time, and then we get all these law changes like the medical. First, we didn't have medical on our verbiage. Then we added medical on our verbiage. Now we're taking medical away again. And I've got 50,000 bags, over 50,000 bags that have medical on the verbiage. So are we going to have to throw all those bags away? Or are you guys going to allow us to just put a sticker over that verbiage with the correct verbiage on it? That's a big thing for me. I would just like to have clear and precise instructions on what we're going to do moving forward. Other than that, I appreciate you guys doing this EAC stuff. In my opinion, I think the EAC board should be of 20 people. There should be more than just 2 business owners on this board. I've applied a million times. I know a bunch of other people applied a million times. I already know why I'm not getting picked, but it's okay. I still love everybody because everybody deserves to be loved. But really, that's all I got. I do appreciate you guys having us, and I appreciate your time.
All right, thank you for your comment. I will point you to the statute that created the advisory council. The speaker, the pro tem, and the governor can put whoever they want on this council. The intent was never for them to help businesses or patients. It's to advise the OMMA. You all are here to give us public comment, but I think it's important to pay attention to what the law says. Mary Lane Porter is our next commenter.
Hi, can you hear me? All right, I'm Mary Lane Porter with Holiday, license name Donnie Britt Kim. I've been in the industry for over 6 years, working with over 400 licenses. So we're very passionate, obviously, so I appreciate everybody staying very professional, and I appreciate you guys hearing us because we want to make sure whatever we communicate is effective. One of the things I'm coming for, I know a lot of people are going to be mentioning this, is the confusion with the packaging and the gummies, for example, where it says it can't have any resemblance to products available for consumption as commercially available candy. Does that mean we can't have our squares? Does that mean we can't have circles? Is there a specific gummy we can have? Because there's every possible shape of gummy. We want to be compliant, but when we call it OMMA, as you know, we have confusion of, oh, we can refer you to the language, but that's what we have questions about. And so that goes, and I know you guys have heard that a million times, so that goes into what I'm saying is that we got to figure out a way to bridge the gap. We definitely want to be compliant. We want to work with you guys. We want to be effective, but we also have to have people that can answer our questions when we do have questions to make sure we are compliant. As John was saying, having OMMA and OBN, having consistent inspectors, having consistent language that we can follow. I would like to just follow up on something random that he had talked about with the signage. We also have that issue. We are a processor. OMMA says we do not have to have the sign outside. OBN says we do have to have the sign outside. Last year was the first time OBN said we did have to have it. 2 weeks later, we were broken into. We then contacted the police, and they ended up getting involved and saying, the DA has an interest in this. This is bigger than you realize. So there's clearly a lot of issues, and we want to figure out how to bridge the gap. With that, I, along with many other people in the industry, are more than willing to meet with every individual in EAC, every OMMA person, every OBN, so that we can bridge that gap. Several people and I have been meeting with as many legislators as possible during and after work hours. Obviously, that's a huge task. There are so many hundreds we need to meet with. We know the committee members are where to start with this. Also, Mr. Roper, thank you for joining. That definitely helps to have multiple business owners. But there's still a giant miscommunication between state agencies, legislators, industry professionals, and patients. So that's what I'm trying to figure out is I know the EAC was created to bridge that gap, but so far we still haven't been able to do that. So the big question is, what can we do? There's also lots of concerns I've heard with Metric, particularly that article came out stating that in another state that they were working with corporations to benefit a select few. I know there's some miscommunication and misinformation there, but all those things I think we can bridge, but we just have to figure out how to move forward together. So whatever we can do to do that, please, we're more than willing to meet. We just want to make sure that this industry is moving in a regulation process that benefits us all because we all want to be compliantly regulated. So thank you.
All right, thank you. Next is Julie Danforth.
My name is Julie Danforth, formerly known as Julie Dewey or Jules. I own Okie Buds Network. I have had the pleasure of wearing multiple hats in this industry and meeting up with lots of patients, and my intention was to make sure that patients had safe access to medicine that they legitimately need, since COVID shut everyone down and it pretty much destroyed and wrecked my entire family and life. At this point, I work with patients, and I'm partnered with Jennifer Jones, who couldn't make it today because she's sick, and she prepared a statement for me to read to you guys. So I'm going to do that in Jennifer Jones's place. I planned to be here today, but unfortunately I got sick. In my place, Julie Danforth of Okie Buds Network has graciously agreed to come and read my statement. Thank you for the opportunity to speak. My name is Jennifer Jones of CPKS LLP Uncensored Family Medicine. Since shortly after State Question 788 passed, I have assisted Oklahoma patients with education, access to treatment, and the application process for medical cannabis. Over the years, our company has connected with Okie Buds Network to establish a patient advocate network across Oklahoma, and we offer mental health services through an affiliate company. Our record demonstrates that patients are and have always been our priority. I understand that the Oklahoma Medical Marijuana Authority has a responsibility to protect patient information, prevent abuse, and ensure that applications are handled appropriately. I also understand why some rules are created. However, over the 8 years of direct experience helping patients navigate this process, I believe there is a serious disconnect between the policies being implemented and the reality faced by the patients who need this program the most. The patients most affected are often those with cancer, multiple sclerosis, essential tremors, epilepsy, serious mobility limitations, age-related challenges, disabilities, and other conditions that make technology difficult or impossible to manage alone. These are not minor inconveniences. For many patients, a portal problem, a rejected photo, a file format issue, or the inability to communicate through a trusted representative can become a barrier between them and a treatment that improves the quality of their life. I have spent an hour and a half on the phone with a homebound patient trying to walk them through taking and uploading a selfie, only to pause, calm them down, tell them to take deep breaths, and then call a local advocate to go assist in person. I have watched a father bring in his adult son who is blind, in a wheelchair, living with cerebral palsy and attached to multiple medical machines, nearly in tears because he feared that a picture requirement would block access to a medicine that had reduced his son's seizures to almost none.
That's time.
Thank you.
Thank you for your comment. Thank you. Okay. We next move to Jeremy Woods.
I'm Jeremy Woods, Wild West Compliance. So I actually had a speech, but I'm going to change it just off the comment that was made a while ago. And I apologize now before I say it. But you stated to Kumbas about knowing what the law is and requirements. So 427.18, Title 63. Medical marijuana packaging shall be packaged to minimize its appeal to children, shall not depict images other than the business name logo of the medical marijuana producer, an image of the product, in your own regulations. It's on page 68. It's 442-10-7-1 D1. At the very last part of that sentence, shall not depict images other than the business name, the logo, the medical marijuana product, or the producer. Here's an example. Been fighting this with you guys for arousal. That's a medical termination. FDA requires not allowed on cannabis. I brought it to you guys several times for the last 4 years. Title 63 has been like that since 2018. I've got dispensaries that I advise them, hey, don't carry this product because it's a direct violation. 75% of the dispensaries carry it. I've had one dispensary report to you how much money they've lost because they took my advice. They don't carry it. $24,000. Dispensary down the road carries it. What's being done? Nothing. So if the House Bill 4454 is very important, we need direct terminology of what it's going to be. Because it's just like that. If you're not going to enforce it, then take it out. That way, everybody has a chance to carry it. Or if you are going to enforce it, let everybody know how you're going to enforce it. And if we would have paid attention to the packaging rules, then maybe we wouldn't worry about what's inside the packages today. That's it.
All right. Thank you for your comment. And I think I'm going to take a moment of privilege I want to remind everyone how 788 was stood up and how there was no staff, there were no policies, there was no procedure, there was no software, there was nothing. So 5 years ago we started building and we're still building. So to expect that every single package had been looked at appropriately would mean that we would have had the staff, the time, the software. We have that now, and we're working on it, which is why the legislature passed House Bill 4454 to give further clarity. So I want to give some perspective for anyone that might be new to the situation or not know what the last 5 years have brought. Our next comment is Austin Jones.
Good morning, everyone. Thank you for you guys coming to the board. Thank you for walking around. It's the first time I've ever seen anyone in Oklahoma politics do that. My name is Austin Jones. I'm a medical marijuana patient activist, policy researcher, and public educator from Washington, D.C. that I call Oklahoma Homo for the past 15 years. I am a founding coalition member of Oklahoma's for Safe Access and founding member of Patients for Safe Access of Oklahoma. For nearly 2 decades, I have worked to improve cannabis policy and patient access through education, research, and collaboration. Since the beginning of State Question 78, I have dedicated my time by studying Oklahoma laws, regulations, meeting with legislators, state officials at the Capitol, participating in public meetings, and working directly with patients across the state. My focus has always been the same, making sure patients have a voice and they are heard. I do not represent a business. I do not represent a special interest. I do not receive a paycheck to be here. I represent patients, the people this program was created for. Today marks 71 days since Kate was removed from this council. For 71 days, patients have been asking us for a simple question: who is speaking for us? State Question 788 is this: because people of Oklahoma voted to create a medical marijuana program, patients should never become an afterthought in the program that exists because of them. Whether people agree with the questions that she brought is not the issue. Public advocacy and councils should welcome thoughtful questions and open discussions. That's how better policies are made, and that's how public trust is earned. And what we see here today, I know we 6 people in this room have been raising these questions for multiple years. I have brought up to everyone at the Capitol, including OMMA, about a packaging approval program. I own companies. 5 years with your guys' status, you'll all be fired. I'm not here to criticize for the sake of criticizing. I'm here to speak to the patient representation that remains a priority. Patients deserve to know that someone is at this table, not police officers and not business owners tied in with the governorship and the people on this board, or in a business-only membership group in the state of Oklahoma. And ultimately, the responsibility for this position rests with the governor of Oklahoma, and this appointment matters because it determines whether patients truly have a voice at this table. 71 days is long enough. It's time to give Oklahoma patients their voice back. That's all I have.
Okay, thank you. Thank you. Justin Wood.
Good morning. I'm going to take it down a little bit. That last one was a little too hostile for my liking. Here to talk about a few things. The first thing that I wanted to ask Director Berry and the board was product classifications. I spoke about this last time, about certain products can only make certain products. Cured biomass can only make cured resin, distillate. Trim can only make cured resin, distillate. Fresh frozen can make whole plant fresh frozen, live resin, rosin, etc. Last month, Metric was in my facility. They said this is a very easy thing to do, but they are not the AHJ, and I'd have to communicate with OMMA. This is the 3rd time now I've come up and asked if we can do that so that we don't have a labeling issue and misleading products, so that patients aren't tricked into smoking something that's mislabeled. This isn't just an Oklahoma problem, this is a national problem. I operate in 4 other states, Oklahoma being one of them. I'd like to see if we can get something fixed with that, so when people go to buy something, they know exactly what it is. You go to buy Tylenol, you know it's Tylenol. You go to buy ibuprofen, you know it's ibuprofen. You get a specific vodka or tequila that you like, you go after your brand. There's no reason now that cannabis is being rescheduled that we can't adhere to those same exact policies. All right. Number 2 would be the decisions made on verbiage changing prior to the foresight that the damages that could be caused from that. Speaking to what John Kumbas said, there's a lot of people, myself included, that have millions of dollars worth of packaging that is sitting there staged to get manufactured. That packaging now has a word on it, says medical in front of the marijuana. What do we do with that? My phone call that is recorded with OMMA basically gave me no guidance, no direction, and my general consensus was grab a Sharpie. There's no grace period, there's no grandfathered in period, there's no way to identify a change prior to it happening so we as business owners can prepare ourselves so that we're not misleading. I do actually appreciate the removal of medical in front of the term marijuana, because now that it has been rescheduled, there's a whole bunch of research that can get put behind it, and we could just call it marijuana instead of cannabis or weed or pot or any of that. Verbiage is very, very crucial as this industry adapts and grows and evolves. The other question that I had was, there's a new test out stating that the metric tags physically themselves are showing high concentration of lead and arsenic on the tags that are going on the plant. That is a new thing that came out this week through independent testing out of, I believe it was Michigan. My question is, with heavy metals and problems that we have and testing and all of that, what's to say that the tags aren't contributing to that?
The other question that I had was the positions on the EAC and the willingness for the people that don't have anything to do with this industry to actually get some education. Officer Johnson has agreed to come to my facility. We spoke about that. You can bring as many cops as you want to my shop. I would love to tell you guys the difference between marijuana, synthetic cannabinoids. You had a comment at the last meeting where you guys weren't sure if the gas stations were selling it illegally or not. If it's a gas station, it is not a medical marijuana dispensary. There is no reason for products that contain any type of synthetic cannabinoids or original cannabinoids like THC to be in a gas station. There's a reason why we have dispensaries and we pay money for that. And thank you so much for your time and have a great Friday.
Okay, thank you. All right, our final comment is from Katie Nail.
Good morning. Thank you for allowing me to be on the board or for the time that I was on it. Congratulations to business owners, police officers. At the end of the day, the cannabis is for patients, it's for treatment. And from the seed to when a patient gets it from a dispensary, it's considered a medicine, and it should be safe for consumption. They should be educated on the medication. I was glad to see that businesses will now be required to continue education. Regardless of what type of business you're in, at least be educated on and know what is being used on products and if there's any effect by the time it's consumed. And I would like to see more healthcare providers involved in providing recommendations on the cannabis in our program. But this goes nationally. A lot of conferences, our regulators and stakeholders and healthcare providers are left out. Not only am I a nurse practitioner, but I also have a master's degree in cannabis science and therapeutics. There's healthcare behind this. And if you're a medical cannabis business and you're about the patients, then make sure that the patients are safe. And that's really all I have to say.
All right, thank you for your comment. Appreciate it. Okay, so we are going to move on to our agenda items. And we're going to start with some OMMA updates. So in the last meeting, I was asked about the recall process, which there have been assumptions made, and I'm not going to address those, but we've been working for months and months. We hired a recall coordinator. He helped us build this website. It even has a checklist for businesses licensed by OMMA. Please bring that up for us, Carmen, and show people where they can find it on our website.
Okay. For the recalls page, this one is super easy to find. It's a new tab on our website. It's about 2 clicks away for anything you need to know.
Thank you. So please take some time to look at that. If you are a dispensary, processor, grower, please take the time to look at that. We reference our rules throughout. We have checklists. So if there is a need for you to do a recall of a product that you have grown or produced, you can go through this checklist and ensure that you are doing it properly. We have scoured other states and learned a lot from how they are doing their recalls, and are making sure that we are talking to industry and patients about where this might be better for them on all ends. So I will pause for comments and questions from the council.
Excuse me. No particular comments addressing this
website here or somewhere you're directing the individuals to, but certainly like to have liberty to address some of the things that were brought up in public comment, maybe to give a little bit more clarity. So I understand that when we're in this meeting, and I know Sheriff McGuire, a good friend of mine, he's going to be very involved as well. And many of y'all have certainly invited me out to your place. Understand work is being done, and outside of this meeting, things are being done. I have met several times with Katie Nell, Jeremy Woods, and a lot of other things about educating our officers and deputies across the state by way of CLE. We are trying to come up with, accredited training so that our guys and gals at a massive level, whether that's in-service training or whether they're in the basic academy, they're getting this information so that we can go out to the community, know what we're looking at, be better informed, more knowledgeable, so that we make better decisions in the field. Once again, this is a new industry that we are coming into, that we've been kind of thrust into to be experts in, and that's extremely difficult. And so we got to start at stage one, and that's how do we educate our law enforcement officers across the state, and that work is being done. I just don't want you to think that your comments are falling on deaf ears and that nothing is being accomplished, because we are working hard and having meetings about this and making next steps to make those things happen.
Thank you, Sheriff Johnson. All right, does anybody else have any questions or comments on the recall and embargo website from the council? Okay, we're going to just move on to rescheduling. I want to talk a little bit about rescheduling. I'm in meetings a lot with other states about what's happening in their state. We know that several states are being inspected already, and dispensaries are being inspected in Mississippi, Arkansas, Texas, Pennsylvania, and some others. We have not in Oklahoma received any word from the DEA that that's going to start here. However, in many states, the regulator did not receive a heads up. It just started. So I just need to let you all know that we don't have any information that we have not shared. We have nothing. We are asking the questions, but we have not received answers. There are several lawsuits pending in federal court in D.C. asking for a pause or a stay on the rescheduling process. I'm sure you all know that, but it's important to keep an eye on those. The OB&DD has announced that DEA registration is required for Oklahoma medical marijuana businesses. And while they are the only state agency in the U.S. to put out such an announcement with a strict timeline at this point, OMMA licensees must follow OB&'s guidance, as you know. We are aware that any licensee who receives a DEA permit will be required to transfer their product to the DEA, which will require a new step in metric. We are aware of that, and this is something that will be addressed once we receive further guidance from the DEA. Questions, comments from the council? Okay, I'm going to move on to some common compliance issues we're seeing in the field that are constantly making it up to my desk, to me. I want to talk through just kind of three of the high-level ones that we're seeing most consistently and we're receiving a lot of questions about. We are going to talk about House Bill 4454, I assure you. Mr. Roper has put that as an agenda item, and we're going to discuss that at length. But I'm going to talk about some other compliance issues that we can hopefully get some standard understanding out there. First, I want to make sure that licensees remember that metric tagging at dispensaries means that you are following 442 10-5-6 and that your metric tags are with your products. That is an expectation. These are medical products. They must be traceable at all times. If we can't come into your dispensary and trace where the product came from, then it is not traceable. Keeping your metric tags physically with the products in the dispensary is necessary. That is required. With rescheduling coming, that is going to be even more important, okay? There will be absolutely no leeway given. You have to keep your products traceable at all times. All right, next, package tagging of clones. You have no idea how many clones we are seeing that have zero traceability. We don't know where they came from. We don't know where they're going. We don't know what they are. Clones must be tracked in the state seed-to-sale system and must be associated with the wholesale package tag, whether cut from a mother plant or transferred from another licensee prior to 12 inches in height. So prior to 12 inches, a package tag. Okay? This is not new. This has been in our regulations. So you're going to want to look at 10-5-6 and 63 OS 427.13 if you need to refresh yourself on those rules. But please, when inspectors go to a grow and we come across thousands and thousands of untraceable clones, we have to immediately take action. That is a strain on everybody's resource. It takes us away from doing all the other things we need to be doing. Let's just tag these properly. All right. Daily inventory reconciliation. That has always been a responsibility of all commercial businesses. Commercial licensees must ensure all on-premises and in-transit medical marijuana and product inventories are reconciled each day in the state inventory tracking system at the close of business, if not already done. That means if your POS system or your API is not communicating properly with Metric, you must do a manual inventory reconciliation. Okay, this is also not new. This is in 10-5-6 as well, and in 63 OS 427.13. So please make sure you're looking at those items. We need all of these products to be trackable, traceable, so we can see the testing at all times. If there's a recall that needs to be done, it needs to be traceable so we can so that recall can be done. So please help us with these items. I'll start bringing more of these at these advisory council meeting and let you know the top 3 compliance issues that we are seeing. Any comments or questions from the council on this topic? Okay, we're going to move on to my final item, which is a staffing update. If you saw recently, we posted a job description, for a director of public health and patient programming and scientific outreach, which is a lot. The job description is largely framed and based on New York's current framework that they've spent years building. We talked to many states. We talked to 5 different states about their public health programs to understand how they got there, what their job descriptions look like, what their teams look like, and how long it took them to get things in order. We had some very, very good candidates, including physicians, including medical professionals and public health professionals. We're wrapping up the interviews and hope to have an announcement on that soon, but it's a very exciting time. This is kind of this last piece at OMMA that we need to be building, and we're continuing to build constantly, and we have for the past 5 years at least. I say 5 years because that's when we did the hard reset in 2021. So we'll be building out the public health framework and putting more information on the website. I will say that our comms team is focused on making sure they're putting out constant information on the website and keeping information up to date. So I am going to pause now for any questions or discussion from the council on these items. All right, we're going to move on to, I'm going to welcome Chief of Science Officer Bobby Gramling to the podium to give us an update on a few things going on in the science department, but most importantly, the QA lab.
Good morning. Like Director Berry said, my name is Bobby Gramling. I'm here to give everybody a quick update. So I'd like to share a few updates highlighting recent progress across our teams. In June, this is for the Quality QA Lab. In June, we launched a new web page dedicated to the QA Lab, which is being shown. The page highlights the lab's progress from the time it was authorized by SB 813 in 2023 to present day. As the lab progresses through the accreditation process, ANAB is scheduled to visit on the following occasions: August 3rd and 4th for our annual surveillance, water activity, filth and foreign material, and terpenes. Returning in September to review residual solvents, microbials, heavy metals, and mycotoxins. Up next, we'll be expanding into other matrices beyond flour, such as oils and concentrates. And for our patient services, I'm excited to announce this. Our patient services lobby officially opened on Monday, June 15th. This space is dedicated to customer service for our patients and caregivers, providing in-person support for questions and assistance. To prepare For the official opening, the patient licensing team launched a pilot program which began in March, helping 50 patients with their inquiries and strengthening the lobby process. Since then, since June 15th, I'm glad to say we assisted 85 patients, generating positive feedback from visitors and efficiencies on one-on-one support felt during each appointment. And after talking with some of these patients, they're excited to have this opportunity to drive in and have some help face-to-face, one-on-one. So very excited to share that information with you all. Thank you.
Thank you, Bobby. Council members, do you have any questions or comments for Chief Gramling? All right. Thank you, Bobby. We are going to move on to a rules update and government affairs update from Chief of Staff Megan Hansen.
Good morning. As Director Berry mentioned, I am Megan Hansen, Chief of Staff at OMMA. I will be providing a very brief administrative rules update. First and foremost, our latest permanent rules went into effect July 11th. You can find those on our website currently. Moving on to our emergency rules, prompted by the passage of House Bill 3143 during this past 2026 legislative session. OMMA is preparing to submit emergency rules to the governor's office. Those will be submitted within the next week. From that point, the governor has 45 days to approve the emergency rules, and once those are approved by the governor, they go into effect immediately. We are notified as an agency, and we will update our website and alert and notify the public once those are approved. Broadly speaking, House Bill 3142 extends the medical marijuana business license moratorium to August 1st, 2028, and amends current statutory language regarding business license transfers. I'm happy to take any questions from the board at this time.
All right, council members, do you have any questions for Megan? Our emergency rules are very brief. They truly just have the language of House Bill 3142 in them, extending the moratorium, as Megan said, and then the license transfers are now prohibited if there's any enforcement or administrative action against the license. And those are the brief updates that will come in emergency rules that we plan to file next Friday, I believe. Thank you. Okay, we're going to move on to council member updates, and council member Roper, you sent us some questions you had on House Bill 4454 and questions you've received from other business owners that we can address today. The packaging and labeling bill, House Bill 4454, authored by Senator Yuck and Representative Newton, was heard and passed during this past legislative session. So we're going to put the bill up on the screen just so everyone can know what we're looking at when we are assessing this. And council members, you have the bill language in front of you. As a preface to this conversation, I want to say that I know this is a big change. It's imperative to remember why the legislature passed the bill and why the governor signed it. My team did some research, went back and watched all of the bill presentations to give me all of that language so I had a good understanding of where the legislature was going with this bill. They started in January with caps on edible medical marijuana products, capping them at 10 milligrams per edible and 100 milligrams per package. The bill changed throughout session and took that language out and ended up with what we have here. So the legislature has indicated, and if you go back and watch their presentations, this is a step one. They're going to keep talking about this. They're going to keep talking because as DHS has started to raise the flag, so Department of Human Services, their Child Welfare Division has raised the flag and reminded us that 215 children aged 0 to 5 were admitted into hospitals in 2025 after consuming medical marijuana compared to 7 in 2015. Now, of course, we don't know that it was medical marijuana. It could have been hemp-derived products. We do know that there have been children recently. I've started asking DHS to track down where these products came from. Did they come from a dispensary? Can we track which dispensaries these came from? Can we track the products, have a look at them, and understand what's happening? So we're working closely with DHS on that. And the number I just gave came from the Poison Control Center of Oklahoma data. So the legislature is going to continue talking about this, and I want to make sure everybody is aware of that. When you say that this came as a surprise change, that is, the legislature iterated on this, discussed it in committees, discussed it on the floor of the House and the Senate. So this should not be a surprise, okay? We brought it up in these council meetings as well. This should not be a surprise. The bill started out putting that potency cap on edibles, as I said. That was taken out. But what the legislature said, and what I believe it was Representative Newton said in one of the bill hearings, because that's what we have to go on when we're working to enforce the laws passed by the legislature. We go back and we see what the legislature wants us to do. It was stated that if it resembles a candy product you can purchase in a store, the legislature does not want the product sold in dispensaries. So to be clear, according to House Bill 4454's just plain language, the legislature does not want products that resemble a candy product you can purchase in stores sold in dispensaries. We're going to talk a little bit more about specific questions that Mr. Roper presented to hopefully get to the root of what all of this means. I assure you we are working with our inspectors to ensure we have a consistent implementation of this law starting November 1st. And with federal rescheduling to Schedule 3 being a reality, the federal government will absolutely start being much more involved in the packaging and labeling of medical products. It will be much more stringently regulated when the federal government is involved. So becoming compliant with this step 1 in House Bill 4454, I believe is good for everyone. It is good for businesses to take this step, but hopefully in the long run, it will help curb that curiosity of children who find containers of gummies and consume them. You've recently probably read the news about the boy in Mustang that consumed a 2,000 milligram edible and ended up in the hospital. This was a regulated product. This was not a hemp-derived product. He was in the hospital for days. So the more the legislature hears these stories from DHS, who receives child near-death reports, the more they are going to continue talking about this. So, Mr. Roper, I did bring your questions. Do you want to ask them, or would you like me to just kind of address them? Okay, thank you. So Mr. Roper's first question was about the scope of 4454. Does it apply to edibles only? And when we look at the language, we indicated that it does. The law references edible medical marijuana products and their packaging only. I'll pause there if you want to add any other questions to that part. Okay, thank you. And then the second question was about logos, trademarks, or established brand markings on the packaging. And upon review of the language, there is no distinguishment between logos and packaging. So the way we read the law says any edible product and its packaging coming out of a processing facility cannot be attractive to children, and I believe that includes the logos, the trademarks, and the established brand markings, and I believe that was the intent of the legislature from what we can gather. Mr. Roper, do you have any comments that you'd like to?
Yeah, I hear from a lot of vendors basically that since their logo has been trademarked or it is part of their company logo, that they should be able to use that. Unfortunately, when they're being told, to seek legal counsel, their legal counsel is telling them it's okay. So I think people like JKJ and Holiday would like to have a clear answer for that. And also regarding other images when we're dealing with, for me, when we say children, I think we all forget that this bill is talking about teenagers as well. And, for somebody like JKJ, when we look at professional imagery, are we considering astronauts or even a chef on packaging as appealing to children or not?
I think if it's a cartoon that is listed in the bill. So that, I mean, there's kind of some questions you can ask when you're looking at a package. The legislature believes that attractive children means including but not limited to cartoons, toys, animals, food, depictions of persons younger than 18, any other likeness to images, characters, or phrases that are popularly used to advertise to persons younger than 18, or any reasonable likeness to commercially available candy. So going through kind of a checklist of does this include these items is going to be necessary. This bill goes into effect November 1st, and so any product packaged on or after November 1st is what we will be looking at. So we will be putting out more information as we get more information, but as of right now, we're just reading the bill and trying to give the best answers possible that we can. The next question that you had, I lost it. Okay, it was about food words, flavor words, and realistic food imagery. I think it would be overreach for OMMA to say that a processor can't put the flavor of the product on their packaging in words that are not attractive to children. So using the word strawberry to describe the flavor is likely compliant if you write it in a way that's not attractive to children. That's the way we read it. So do you have any comments or questions on that?
Yeah, I mean, does that also include a basic image of a fruit or an apple? Or are we going to consider any food imagery non-compliant?
I don't think we have leeway because food is listed as attractive to children in this bill. In 7A, it says use of any image or words, including but not limited to cartoons, toys, animals, food, or depictions, et cetera, et cetera. So that's where, you know, being the executive branch agency, our job is to just implement the law as it's written.
Yeah, I understand it, but because of the phrase designed or likely to appeal to persons younger than 18, that comes before the list that includes food. So that's our concern. I mean, is this going to be a subjective opinion of an inspector that JKJ can't have strawberry and a picture of a strawberry on it, or a picture of a square gummy that looks like the flavor of strawberry? For me as a dispensary owner, you know, once I accept it, then the liability comes to me. I'm okay with plain packaging. I just don't want a vendor to show up. Being a multiple dispensary owner, I got staff that are going to be doing intakes on these products because I can't be at every location. And if a vendor is sitting there with a delivery going, well, my attorney said this is acceptable. And for me, I just want a clear idea of what I need to educate and put policies in place for my staff. If it has a fruit on it, don't accept it. It's where I need to go with, you know, helping myself and other dispensaries.
Yeah, and thank you for explaining it from your perspective as a dispensary, but also working with processors and your vendors and that kind of thing. That's what we're trying to take into consideration as we look at this law and figure out how to train our inspectors on enforcing it. So obviously our general counsel is sitting here, and we will continue to have these conversations and put out more information as we have it. We do know that, 11 states with legal cannabis programs, whether medical or adult use, do require package pre-approval, and we're looking at those. 5 have optional pre-approval processes. Either one would require a legislative change, but what we're hearing from other states is that it works pretty well. And so I know, Mr. Roper, you asked if we would be willing to talk with the legislature about this, and we're doing the research so that we can offer them that information if they would like to go that route. I will say, interestingly, when we're looking at all these states, and I'm talking to some of the people that run the programs there, it's going to be it varies. Some states charge the licensee to review the product. Some states don't. So we'll need to give the legislature this information so they are aware of what staffing will need to be able to review those packages and give us some guidance on how they want us to review these and how they want us to approve or deny these packages. So to your question to us about whether we would be willing to, we will offer the information to the legislature. And then existing inventory and transition period. We scoured the bill. We read the bill as plain language as possible, and it appears that products packaged after November 1st, November 1st or after, November 1st or after, must be compliant with House Bill 4454. So this is the grace period. I mean, if you're packaging it now, you're fine. It's just what you package November 1st and after must be compliant with House Bill 4454. Any questions or comments on that?
Well, that helps us a lot, right? Because we're trying to determine whether we should stop accepting packages now so that we don't have excessive inventory come November 1st. So allowing the sell-through for anything that we've already received November 1st is great. It doesn't mean I want JKJ to offer me a lot of product up front right now, but it does help us in our planning and also staff education on whether they should accept anything, currently or not. So thank you for that.
Okay, thank you. And then I think that's the questions that you had for us. And are there any further questions that you'd like to ask on this right now?
Well, I believe somebody else brought it up as well. The current OAC rule for the products is pretty broad. It includes everything. And this House bill basically has narrowed the scope to just edibles, medical edibles. Are you guys considering narrowing your packaging requirements just to edibles, or are we just going to leave it broad across all products?
Oh, you're saying the two different, so you're saying the previous to House Bill 4454, the broad requirements about all packaging and labeling. How about this? If we were going to go out and enforce packaging and labeling, we will put out some information before if it were on anything other than edibles. Right now we're focused on enforcing this bill, and that is specific to edibles. Are there other council members with any questions on this? Okay, council members, did y'all have any other agenda items you'd like to bring up that we did not have included on the agenda? Okay. Well, I think that's it then. Okay, so seeing no further matters to discuss, right?
Any matters 24 hours, this one
Okay, thank you. I'd like to thank you all for your time today. Our next meeting is scheduled for Friday, October 16th at 9 a.m. and we'll be in here again in 5:35. At that meeting, we would like to take ideas from the council on the upcoming legislative session. So any ideas that you would have that you would want the legislature to hear from the council about. Keep an eye out for your October agenda. If there's nothing else, I'll entertain a motion to adjourn.
Motion to adjourn.
Okay, motion. Do we have a second?
Second.
Second from Matt McGuire. All right, all those in favor?
Aye.
Aye. Okay, meeting is adjourned. Thank you.